Good afternoon to some, good morning to others, and it may be even good evening to others on this webinar that we're having with our families. Thanks to all for joining us. Needless to say, the last 48 hours have been a whirlwind, I think, for all of us as we continue to digest and to kind of grab hold of the unfolding and developing situation that is in front of us. So we appreciate all of our families who are online with us this afternoon. Before we get started and I introduce my colleagues who are on this webinar with me, a few housekeeping. One is that you are all on mute because, again, of interference of noise and all of that. And so we appreciate your patience with us on that. But please continue to send your questions through the chat box. And we have members of our team who are monitoring that and will be providing us with those questions. And we'll try to get through as many of them as possible as we can over the time that we have with you. The second is that this will be captioned. And so for those who are in need of captioning, please get to the section for captioning so that you can be able to follow with us as well. And then the third thing is, because we know that not everyone could make this call, just remember that we will be recording this and we'll be forwarding this to all of those who register for this webinar. Because we know that there's a lot of information and we don't expect that all will be remembered, and we want to make sure that you have the opportunity to go back to it after this. And for our families who were not able for different reasons to be with us and had registered, we want to make sure they don't feel like they've missed out on this. I'm Dr. Fanta. I'm Vice President of Campus Life and Inclusive Excellence at American University. Have been co-leading the effort around response and preparation for the university along with all of my colleagues, of course. I have on the call with me today, I have our Dean of Faculty and Deputy Provost, Mary Clark, who is joining us. Mary, if you can please wave so everyone knows.
Good afternoon.
Thank you. We also have on this call Lisa Freeman, who's the Director of our Residence Life here at American University. We have Mark Hayes, who is the Director for our AU Abroad program here on the call with me as well. We have Chris Silva, who is the director of our housing team here at American University. And then we have Tracy Calandrillo, who is the assistant vice president in the Office of Campus Life. Will be possibly joining us is our resident medical doctor, Dr. David Reitman. As you can imagine, David has been quite busy, and we want to make sure he stays focused on our #1 priority, which is making sure on the medical side that we continue to stay the course on where we are. With that said, we already have some initial questions that have come in from families, so we're going to jump right in to get to some of those questions, and we'll continue again to field other questions that come up. And so the first question is, of course, what's been, I think, on many people's mind. Yesterday, you received from us notification that we have our first confirmed case of COVID-19 here on our campus. Let me first start by giving you the lay of the land. The issue of would there be or could there be a case of COVID-19 on our campus for us was not an if, it was a question of when. We've been preparing and we have been working collectively across campus for the last 2+ weeks. And my team and I in particular have ran the scenario of what would we do from a preparation and response perspective if there's a COVID-19. So let me first start by saying that this was not a surprise, I think, to any of us who've been in the trenches of preparing the university and as we continue to monitor what's going on around this country and around the world. So with that said, I want to give a little bit of context for how we've been preparing and what we've been doing. First, again, we have our medical director, David Reitman, who's been very central to our response and preparation around COVID-19. In addition to David being our medical director who works with students, David is also very much connected to the Department of Health here in Washington, D.C., as well as to medical professionals all throughout the D.C. area, and has continued along with many on our team to monitor with the CDC. With that said, in our scenario preparation, we ran exactly the protocols that we had been preparing for with the COVID-19 case that we have on campus. And I want to give you a little bit a lay of the land on how we manage these things. First and foremost, we've been saying to every member of our community, and we're going to continue to say this, anyone who has any of the preliminary symptoms that are listed by the CDC, we've been asking people to immediately disclose that as soon as they're aware of that, if they're students and others. And the students in particular will report that to our student health center. And they're asked to call in, and we have a triage system with folks who are dedicated solely to be looking at these cases as they come up. So this is exactly how this case went about. Was the student disclosed that information as soon as the symptoms became apparent, and our medical doctor followed our process, which was to immediately reach out to the student and to proceed accordingly. The first thing that we end up doing generally is to test for flu and to test for strep throat and others. And if that shows negative, and if we know in particular that the student has been to one of the risk areas with CDC level 3 or other areas in the country with high level of cases, our medical doctor goes ahead and order testing and proceeds with testing. And then once they've proceeded with testing, it is sent to the lab. The immediate thing is, as soon as that student has been, we're aware of it, and the testing, and we do testing, the immediate thing is to go through the next step, which is self-isolation. And we have an entire protocol around that. Follow that. That self-isolation includes being in a single room with a designated bathroom, and the student is not to leave those premises. Food is delivered at the door, and we have a team that is responsible for the management specifically of that. And we make sure that we don't have others who are in any way, are going to be exposed in the ways that they need to. Once we get the test results, and this is the protocol that we must follow. Once we have the test results, then our team immediately notified the Department of Health, and they've been in conversation with the Department of Health. And it is really important, and I want you all as family members to really understand this. Once someone tests positive, the coordination and next steps are dictated by the Department of Health. It is the Department of Health that initiates contact tracing and the next steps related to that, and that is exactly the protocol that is followed. And the memo that was sent to you indicated, and we have assurance from the Department of Health that there's been no risk exposure to others, and we are following those protocols, and the student remains in self-isolation for the duration of time with monitoring and everything else that needs to happen. We also, whenever we engage in, when we engage with a student on these matters, we also immediately notify their emergency contact when they've tested positive, and we exactly did that in this case. Now, families and others have been asking a lot of questions, and one first question is, disclosure of the name of the student. Under no circumstance will we disclose the name of a student when these are medical situations and medical cases. We know and we understand that everyone wants to know what's the exposure and what's all of that. We're very aware of that, but you all need to understand from a medical perspective and from a confidentiality and medical privacy, we cannot and will not disclose the name of the student. Others have been asking, disclose the residence hall or where this student is. We have to take every appropriate measure for the making sure that those areas are clean, making sure that there's no additional exposure and everything. All of those have been followed. And so I wanted to make sure that we're all clear on what the protocols are and what the process are. I know, and we're not naive to think that people will still not be anxious, but I really wanted to make sure that we all understand where we are. And with that, I have David Reitman, our medical resident director, who's on the line with us. And I didn't know, Dr. Reitman, if there was anything else you wanted to add to this scenario here.
Can you hear me, Fanta?
Yes, I can. Thank you.
Okay. I don't know if I don't think my webcam can work, because I think there's too many people already up there. But I don't have anything else to add. Like I said, we followed all the protocols that we had set up well ahead of time to minimize any risk of exposure. This has been very well contained. The Department of Health has been, our partner through this throughout the entire time, and we've been, so far everything, the student is doing extremely well, and we're going to follow, their guidelines and work with them if anything else, comes up over the course of the next couple of weeks. But this is where we are at this point, but so far everything is going on track as best we can expect in a situation like this.
The other thing that I did not share also, which goes of course without saying, is in these situations we have our facilities team who do a thorough cleaning of all of the major areas and everything. All of those protocols have been mapped out and we follow those protocols to a T. We're very well aware that in the environment that we're in and the times that we're in, we want to make sure that we remain vigilant. We want to make sure that the health and well-being of everyone is being considered. And so I wanted to also add that as a dimension to this. I don't know if Lisa Freeman or anyone else wish to add anything, but this is where we are with this. And so with that, I want to move on to some of the other questions, please. The question is, can I or someone else have a packing and shipping company come to campus to pick up my residents' personal belonging? Thank you. This is a question that I know a lot of you on this call have had and have continued to have. And again, let me provide where we are and why we are where we are. We are aware of this as an important need and we want to do everything we can. What we also wanted to make sure is to make sure that we can get, and with confidence, a list of vendors who are licensed so that we don't have, price gouging and everything else that comes with this time. And so our procurement teams have been actively working on that. We will be able to make an announcement sometime by this afternoon about what we have been able to find in terms of vendors who not only are licensed, but who have the capacity and the bandwidth to be able to support the and shipping and storage. Because the other thing we didn't want to do is have people run around whereby you may find some vendors, but you don't know if they're licensed or not. And or you may find vendors, and to avoid frustration, they may not have the bandwidth to be able to support this. Now that we've had this information and they're finalizing that, we will be able to communicate that information to you. And so to answer the question, is that possible? The answer will be yes. And we'll be communicating that to all of you as soon as we get that finalized. So wanted to say, yes, it's in course, but it is not that we've not been wanting to do that, but we wanted to also make sure. Because as you can imagine, there's traffic of people coming in and out. We want to make sure that our buildings remain secure. We want to make sure that the rooms of students and their belongings is also secure as much as possible. But that is where we are. And to say simply that our procurement office has been able to secure that, we're just finalizing it. And you will be able to get that information as soon as it's final. And we're looking to today to be that day to be able to provide that. Thank you for that. Chris, I don't know if you want to add anything to that. Or Lisa.
Yes, thank you, Fanta. So currently, and actually since a few days ago, we've already had a process available for students to request and to authorize another individual to pack their items for them. So that's called the Proxy Form, and it is available on our website, in the Housing Residence Life website, where student can authorize another individual, making sure that the roommates are also in agreement with this. And several students have already utilized this resource. Actually, as of this morning, we had already about 120 students that had utilized this service, this process. So, and just reminding all students and family members that it's really important that students complete the expected checkout move out form, which is in the student's email address. It has been sent multiple times to students. That is helping us plan and know students' plans. Thank you.
And again, around this piece of vendors and companies, to ship, we know that for many of you, the question was, I have my student who's already at home. I don't want them to have to come back here. What is the alternative? And so this, hopefully with the company and so forth, in addition to the proxy access that were provided, this will help answer that question and alleviate some of those concerns that have come up. So we'll be able to certainly get that underway by the end of this afternoon. So thanks for that. The next question that I know is on everyone's mind, at least if you're parent of a senior, and that is what's happening with commencement. And again, with commencement, we continue to evaluate the situation. Again, this has been developing very rapidly, and it keeps moving by the minute and the day. So we will be coming back with where we are with commencement and where we think it's going. We understand, as we said, that this is a very important milestone for our seniors and the celebrations that come with that. And I know families are trying to make plans, and some have already made plans, but we will be getting back to you as soon as we can as we're looking at this. I think a lot of you can imagine that for us also, this is a time for closure for us and the families and our students. It is a very important, uplifting time for all of us. And we would want to do everything we can to what I call honor those rituals. But we also, as we all know, things are unfolding very rapidly. And at the end of the day, we want to make sure that the health and well-being of all is what is central. And so we will be communicating on that. And we really appreciate your patience with this. Know that it is front and center of our minds as well, particularly for our families who are seniors. Also, many of you have asked the question of any information on when and how to expect refunds from housing and dining. The refunds process will be unfolding as we speak, as people check out and all of those happens. The refund is to be done by early April. That is the timetable that our student account office and finance office will be doing so. And we have posted already on the frequently asked question some of the responses to that process so that you know what the process is going to be, etc. We know that that is also important to all of you, and we want to make sure that we are on that, but that will be for early April. Tied to that is the question that we've heard from some of you, and I think it's an important one. It says, any chance to postpone tuition payments for April and May for families who may be struggling to pay? Yes, we hear you. And we know that these are very, very challenging times for some of our families, and we want to be able to work with you. So what we're asking is for any family who knows that they're in this situation of tuition payments for April and May to please reach out to our Office of Student Account. There are things that we've already put in place and that were decisions that we made yesterday. Yesterday, we made the decision to put no stops on any student's account, and that is already in effect. We also put in place measures around billing and everything, and we basically have been suspending billing for a period of time, and those questions and answers will be posted to the website. We know that these are challenging times. We know that this is unprecedented time, and we know that as a university, we too have to take some different and new approaches to this so that we can all work together in partnership. So I want to tell you that we are listening and we are paying attention to that, and we've already made some decisions around stops on account billing so that pre-registration and everything is not stopped for students and their families. But also, if you have specific circumstances, we encourage you to please reach out to our student account office, because we want to make sure they're working on a case by case in addition to the general decisions that we've made. We know and we want to work with you. That is the question around the piece around payments and refund. With that, I want to switch a little bit and go to academics. And there are a couple of questions around academics that I'd like my colleagues to be able to chime in. The first question that we have around academics, and this is for Dean Clark, when should they expect to hear from their faculty member if they have not already?
Thank you for your question. And my expectation is that the faculty have already been in touch with your students. I have been reminding faculty to reach out, to be alerting the students to what the plan is for the online learning moving forward. If your student has not yet heard from their faculty member, then I would encourage your student to reach out to their department chair, program director, or dean to alert them. I heard from a student today who hadn't yet heard from their faculty member, and I was able to follow up with the department chair and get that corrected right away. So please do reach out to department chairs, program directors, or deans with any concerns about lack of communication to date from faculty. I, on my end, will continue to remind faculty of the importance of connecting with their students with a plan. Thank you.
So tied to that, Dean Clark, is the next question, which is, what advice have you given faculty about how to support students during this transition?
Yes, thank you. I've been in touch with faculty both individually and then as a group about the utmost importance of understanding and flexibility with our students at this time. That it is that understanding, it's that human compassion and warmth that we all need at this time in order to move forward. And so please know that that message has been sent to our faculty, and indeed has been very warmly received by our faculty. The number of notes that I've received from faculty saying, yes, that is very much the message that we should be conveying and encouraging at this time.
The other question related to, again, academics, Dean Clark, is, are we considering pass or fail options for classes?
Thank you. We are looking at this option seriously. A couple challenges present themselves, and those relate to our accrediting bodies. Certain accrediting bodies for a number of our majors require that all major courses, i.e. coursework in the major, be completed for a letter grade. That pass-fail is not acceptable in the major courses. And so we're working through these issues right now. There has not been a determination made, but very much we've heard folks' concerns, and we're looking to identify what type of flexibility and understanding we can provide.
Thank you. And now I want to switch to study abroad, which is again part of the academic questions that have come in. And Mark Hayes, we're going to need your help with that. How will students who just returned from study abroad figure out their academic plan for the rest of the semester? And this is for both Dean Clark and Mark Hayes.
So I'll take the first stab at this. So obviously, this has been a very busy time for us. We had over 440 students abroad when we had made out the call to bring everyone home. So our team has been focused first and foremost on getting those students back home and to positions where they can be supported. We are now have the last 2 days been moving into the second phase on academic continuity. In almost all cases, we're able to work with our partners abroad and with our host institutions on online options for those students. So those courses that they started abroad face-to-face will now move to an online format, much like we're doing with the courses here on campus. So they will be able to complete their full academic term and keep their credits whole. There are a few isolated issues we're dealing with now. So each of my staff and the advisors who are working are looking now student by student for those where we need to kind of make extra efforts to make that academic program whole. So their advisors will be reaching out to them directly. We'll continue to work with them, and then we'll start interfacing with faculty here on campus if we need to supplement as needed.
The other question is related to study abroad. For students who had to leave study abroad location, will there be opportunities to re-enroll in the future?
Absolutely. As you can imagine, my primary job is to send students abroad, not to bring them home. So our intention is to continue to move forward. So for all programs for the fall and academic year, we are moving forward. We are continuing to process applications. Those students whose study abroad program was disrupted this semester, quite a few have come to us and said, can I go abroad next semester? We are working with them on slotting them into positions and working through those issues now. It's taking a little time as we're focusing on a few other things, but we are definitely moving forward full steam with the fall and academic year.
Can you also talk about refunds for study abroad?
So refunds. So this is probably the most complicated issue for us as we deal with over 70 partners in 40 countries. So we are working through each of those issues right now. So our guiding principle is if we are able to get refunds from our partners on the ground, or if it's expenses that have been made, we will refund that money to students. But this is a case-by-case, student-by-student, program-by-program process, which for us is very complicated and will take a little time to sort out completely. As a first step, in order to facilitate the return of all students abroad, they are getting reimbursements up to $750 for any flight changes they made or any rebookings that they needed to do. And we're processing those now as they come in and hope to have those out within the next 2 to 3 weeks. And then we'll move on to the next phase to see what refunds could be provided based on us working with our partners abroad and all of our host institutions abroad.
Thank you. Again, staying on the academics questions, the question is, how should students proceed if they have internship required for graduation or for their major? This is for Dean Clark, the internship question.
Yes, and so we've been working closely with our deans, our faculty, and the director of our Career Center on how best to proceed with internships or credit, especially for students who are about to graduate. And what we have encouraged faculty who are overseeing these internships and assigning the credit to do is to come up with alternative assignments that students can complete. And likewise, we have been encouraging our employers to be assigning work virtually so that all of our students can complete their internships. The good news here is that quite a number of students had already completed the required hours by the time of spring break. And so I'm optimistic and indeed confident that we'll be able to bring this to closure satisfactorily.
Thank you, Dean Clark. Again, next question is, I want to move to, again, issues of health and wellness. This is for Dr. Reitman. What recommendation do we have for students living off campus to stay safe? And I'm not hearing Dr. Reitman. Let me start by answering that question. What recommendation we're giving them is the recommendation we're giving all members of our community, students, staff, faculty, as well. And that is that we all need to continue to comply and to follow the guidance that CDC has provided. And that is around social distancing, which is an important one. I don't know if you're aware, but yesterday evening, as of 10 p.m., the mayor of Washington, D.C. closed down restaurants. Effective since 10 p.m., restaurants will no longer open, and there's only the opportunity to do pickup or delivery. This is all about social distancing and large gathering and all of that. So we're seeing these things take effect, and we've been saying all along, and we'll continue to say to members of our community, it is the common hygiene, it is the social distancing, it is also making sure that they continue to monitor any symptoms they have, and if there's students, to please notify our Student Health Center so that Dr. Reitman and others can respond accordingly, as we did with the case that we just had talked about. That is first and foremost very important for people to stay abreast of this and to make sure that they're doing that. The second thing is, will we be refunding or prorating rent for off-campus housing? We unfortunately can't do that. We're not in a position to refund or prorate rent that are off-campus. Students have signed leases with major apartment complexes, and those will be contractual obligations that will need to be negotiated with those apartment complexes, and the university unfortunately is not involved in that and has no leverage, frankly, in that area. And so I wanted to make sure that you are aware of that. That is not that we're trying to punt this. It's just that these are leases that are signed separate from and are not contractual agreement with the university. The ones that we are responsible for with contractual agreement, we've already talked to you about the proration of housing, so that is the case. Again, around safety or anything, Dr. Reitman, I think you're back on the phone. Is there anything else you wish to add to that question?
I just want to say that for anybody who is living off campus and is going to be in the area, the health center is open. We are not closed. We are functional. If students have to be seen for any somatic or medical needs, we're there for them. If they are, the only thing that I would mention, as Fanta had just spoken to, is that if students are worried about having COVID-19, they should call the health center first. We've got an email address that's posted on our website, shccoronavirus@american.edu, to email us, or 885-7777 call, and to speak with our triage nurse first to kind of determine what is the best course of action rather than just making an appointment and coming in. But for other things, we can take care of other health needs, that type of thing. I will also just mention, just in general, that if students are needing stuff, so many of our students have had issues where they are needing refills and that type of thing for different kinds of medications. We are going to try and accommodate as best we can. Ideally, if a student has a chronic medical condition, whether it be a psychiatric condition or a physical medical condition, we're encouraging students to follow up with their physicians and their providers at home and reconnect there to get those. However, we know there are some students where that might not be a possibility, and if they're having an issue, they're encouraged to secure message their provider here, and we can work with them to be able to make sure that there's no lapse and they're getting the treatments they need.
To follow up, Dr. Reitman, because some of our students will be away from Washington, and some of our student health insurance plan, on the health insurance plan, would you mind just sharing briefly with families for those who are on the health insurance plan and will be away from DC, the provisions that are there. And again, we'll be posting much more significant information around the health insurance plan and how students access it. But I wonder if you could briefly talk about that, please.
Well, I think it's important just to remember that this CareFirst plan is a nationwide plan. So this is not one that is just for students while they're here in Washington, D.C. They can use that insurance anywhere in any medical clinic with any provider. With this plan, they do not need referrals or anything along those lines. All they need to do is have their card or a picture of their card and bring it to any provider where they want to get care, and it'll be accepted as just like any other parent's plan is going to be accepted. This is a nationwide insurance.
The other thing that I will let you know is that we've been in conversation with CareFirst as well, and CareFirst nationwide has also made some decisions, knowing that these are very unprecedented time and have come up with some new provisions. We will be posting that information on our website. We just received that information this morning as we speak. So they too are taking into account the need for perhaps for waivers and other things to really try to streamline as much as possible the care, knowing that this is very unprecedented time. So we will be also posting that information. CareFirst is going to be reaching out to all who are insured with CareFirst with that information of what decisions they've made to try to streamline and make sure that care is accessible to all. So just wanted to make sure that you are aware of it. And if your student is with the CareFirst insurance plan, they should expect to be getting some communication directly from them around access and other provisions. So wanted to make sure you were aware of it. The other thing I want to talk about quickly are things like, are there food options on campus for those who are on campus now for move out? The answer is yes, and that is posted on our dining website. There is the hours of operation this week for breakfast, lunch, and dinner. We regret and our apologies to families who were here this weekend. It is the case that we didn't have much open and available, but that's been remedied. And since Monday, we do have operations for food for those who will be on campus, and we'll continue to provide that, of course, because there will be students on campus for a period of time. So just wanted to make sure that you are aware of that. And the hours of operations are on the dining website. So wanted to make sure you were aware of that. What I have, I have Dr. Calandrillo on the line. Tracy, would you mind sharing with the families a little bit about how we're addressing needs around services, and perhaps you can talk to them about how they'll be able to access services, specifically mental health and other services while they're remote, please. Thank you.
Sure, yes, I'd be glad to talk about that. So many weeks ago, as we were starting to think through what we would potentially need to shift if our community became remote, was understanding that a lot of our services need to be accessible to everyone, no matter where they are, in whatever way they can be. So first and foremost, I'd encourage everyone to go to the FAQ section of our website, because there's a lot of information there, just giving you some overviews of how the services are set up. Each department, so that might be the Academic Support and Access Center, the Dean of Students, the Health Promotion and Advocacy Center, have information on their websites as well about how to access the services. And most departments, like the Dean of Students, is still functioning in the same way. They're meeting with students online or by telephone. And students can schedule appointments with the Dean of Students team, and that should be relatively seamless. There are a couple of exceptions that I do want to talk through, and I think it's important for everyone to understand that when it comes to mental health care that's provided by licensed professionals, and this is a national issue, so it's impacting everyone in the country, our providers are only authorized to perform their services in the jurisdiction where we're licensed. And so what that means is that our therapists and our psychiatrists in the health center are limited in what they can do for our community once that person is physically not in the District of Columbia. So we're doing our best to work within that. There's actually, we've been spending time advocating with our professional organizations, and they're advocating with Congress right now to do some things to try to suspend this national bottleneck that's making it difficult for us to be able to continue to care for our community. But nonetheless, for legal limitations, there are some ways in which our counseling center is working differently. That being said, We are working with everyone, the counseling center is working with everyone who is already in therapy with them to connect them to resources, and we're being as liberal as we can and having phone conversations. We also have a virtual waiting room set up in our counseling center, which is seamless and pretty easy for students to get into, to make an appointment to talk with one of the clinicians there. You may already know that we work with a company called Protocol that provides urgent care and telephone counseling to any of our students globally. So that is one really important tool. I'm very glad that we've had that set up already before we got into a situation like this, so that any of our students who are in distress can call that number 24 hours a day and speak to a licensed clinician to get support and to help them through whatever the distress is. And they do an excellent job. That's a company that's also working with many universities across the country. So we're very lucky that we already had that relationship with them, because our students are able to avail themselves of that anytime they need to. Dr. Reitman spoke a little bit about some of the issues for our psychiatry team in the health center, but they are working with the patients that they already have a relationship with, so that each student has a plan moving forward about either connecting to a provider at home to continue their prescriptions, or if there's a way that we can make that work here. But they have that same limitation. If they are not licensed in the jurisdiction where the student is, we're not able to keep that ongoing care going. So we're trying to be very forward thinking about that. And then I don't know that I missed an office there. I think the only other office I would say, the advocacy team for students who are continuing to receive support around interpersonal sexual violence, they are meeting with their students online or by telephone, and have a way that students can access making appointments through a web platform.
I want to also add that Tracy talked about some of the services, but let me be very clear. We are committed to making sure that the support services that were available to students when they were here physically continue to be readily available to them, and that it is being readily available virtually and in other ways. This includes advising. Our advisors stand ready to support our students during this period of time, and to be accessible and to continue to do what they've been important stakeholders in doing. So I want to make sure and reassure you of that. The same way our Academic Support and Access Center, whether it's around the tutoring and coaching, they have been working hard on making sure that those are things that continue to be readily available, including our disability support and all of that. So I'm saying this to say we've been hard at this, and we want to make sure that as students transition home, they do not feel like in transitioning home, all of those support services that were here to anchor them are gone. It's going to take a different form in that it's virtual, but we want to make sure that that is there, because we know first and foremost that these relationships matter to our students. It is particularly the case for our first year and second year students who are just getting used to AU being their home. I can't tell you this weekend the number of families and students that I spent time with, and I cannot tell you since Thursday the number of Kleenex boxes that I've gone through. And so it does tell me that students have found their home here. It is heart-wrenching for all of us who are here to have to kind of say, for now, we will see you later. And as we've said to students and the families, this is not goodbye. These are not goodbyes. It is really, we will see you later, and we want to make sure you are safe and that you are with your loved ones during this period of time. But your AU family will remain here, and we will do what we can from a distance. And so we are already talking about how can we stay in touch with students when they're away? How can we make sure that there's a routine that is somewhat established? And as I said in my last webinar with families, this is a partnership with you. We want to make sure that we remain in partnership with you and that we figure these things out together. We know that it's not only a transition for the students, it is a transition for families. Some of you were not exactly, thinking that your student would be back now. You were preparing for maybe the summer, and all of a sudden that's been accelerated. We know that that's uprooting for many people. We know the stress that comes with that. We know the last minute preparations that come with that. We hear you and we understand, and we are going to have to work together on that. I just wanted to make sure to say this to you all, because I think it's important for all of us to have that conversation. The other piece that I know was asked is, are there any plans to change the March 23 move out date? I know this has come up. I have received emails after emails, and the answer is no. We are not looking to change that date. And I know it's a hard one for people to understand. I don't have to tell any of you how much the situation changes minute by minute, day by day. And as we look at what's happening in Washington, and we know it's happening around the country, we know it's happening internationally. And there are lots of parts to it, and we're trying to figure it out as much as possible. You said we need help with getting the packing and the storage and the shipping done, and we're working with companies. You said we need proxies because our students are not able to do that. We're trying to do all of those things, and we're going to continue to do the best that we can. But we need you to please continue to work with us. We know this is not easy. We know that there's been some frustration that have come with that. We try to communicate with you as much as we can, and we try to be as transparent as we can. We don't have always the answers, but believe me, we try to get those answers. And sometimes we'll come to the place where we will not agree. And that is what happens. And we understand that. And we know that with those disagreements, I've gotten my share of emails from some folks who very indicated their disappointment and everything. I hear you and I understand you, but I also hope that you understand that we are acting in goodwill and we're trying to do everything we can. My team, the entire university, I don't have to tell you, we have not been getting a lot of sleep. We are at this because we know we have a responsibility to you and your students. We know you're far away and we're doing everything we can. And so one of the things that I am asking of each and every one of you is to please continue to be patient and please assume goodwill. These are very difficult times. And the last thing I think any of us need is to turn on each other. It is really a time for asking for goodwill and for your patience is what I'm appealing to each and every one of you to please do. With that said does our advice on residence hall apply to the frequency? The answer is yes, because again, it is about what is it that we're trying to achieve and how we're trying to achieve that. That is part of what we're looking at. You've asked questions about any word on summer classes. What I can tell you is we will be suspending our study abroad over the summer. And as you can imagine, there are lots of reasons for that. Word on summer classes, we're already talking about how many of our classes can we put online. Knowing that this situation is unfolding, we also know that students are anxious to make progression toward graduation. We're committed to getting students to the finish line. There is nothing more gratifying for us as educators to see students come, thrive, and get to that finish line. We all have that same aspiration. So our team in academic affairs have been looking at summer classes, how we can get those online so that people can progress, and we'll be providing more information about that. And I don't know if Dean Clark wanted to add anything to that specific question, because I know it's on all of your minds, is you want to plan ahead, which is absolutely understandable.
I simply wanted to echo what Fanta just said, that we are looking to expand our online summer coursework so that students can continue to make academic progress. So that is job one for us after going online tomorrow. We're putting a lot of time and thought into that and would welcome individuals' input. Thank you.
The other question, which is also tied again to this piece of sort of academics, Dean Clark, library books, rental books. So that's another question that I know has come up. If you have any insights, and I can also add as well.
I can offer a couple observations about the library. The library faculty and staff have been working very closely with our faculty to get all materials copied and scanned, placed online so that they're available to our students for their newly online coursework. I also know the library has been giving dispensation to anyone who has materials borrowed, not to worry about those due dates. Please bear in mind that the library has many thousands of databases online. So for students to be able to complete their coursework, conduct research, what have you, those materials will be readily available. The rentals that I believe you're speaking of come from a third-party provider in more cases than not. And I think Fanta may have some insight into how we're managing through those contracts.
Sure. So for third-party, which is our kind of bookstore and vendor that does rental, we are working with them. They also understand that these are unprecedented time and that we're going to need to make concession and be creative about how those are done. So that will be communicated. For those who have rental in other ways that are not tied to the university sort of vendor that we work with. We're going to ask you to do direct communication to those vendors to see how you can, in many ways, look at the rental piece of that. But it definitely, for the one that is with the vendor that we work with, we've already been in conversation and they understand that that will need to be something that will need to be facilitated, and we'll be able to provide more information about that. So please stay tuned to that. We also know that one of the things that happens for students to be at American, we have a lot of our students who work. And I go one step further and say many of our offices would not be the same without those students who work. As someone who's in campus life, we work very closely with students. We work with them because this is also part of their developmental sort of way of getting introduced to what professional life is, and they provide invaluable contribution to the work that we all do collectively. So we do know that on-campus employment and off-campus employment is a really important part of the student experience, in addition to the finances that comes with that. We know, and we've put on the website what we're doing. The Department of Education has specific provisions that allow us to continue to compensate and to pay those who are on federal work study, and we've put that information out. They've allowed us to continue to pay federal work study students, and we will be looking to who can sort of do it from a telework perspective. And if they're not able to, the Department of Education has made an exception for those payments to still be made. And that is incredibly important because our federal work study students are students who are coming with really the need for this funding, and we know how important that is. We also know that in addition to federal work studies, we have quite a lot of students who are on part-time wages, and a lot of them were working on campus, and with these changes, it's going to be hard. Well, we have basically instructed our managers and those who have part-time wage students to do what they can creatively to continue to figure out ways to engage those students in work from a telework and otherwise, and continue with that as much as possible. And for those who are unable to do so, our Human Resource Office will be collecting the information of who are those students who still don't have work, so we can see whether or not they can be redeployed in other places and so forth. That is coming, and we're going to do what we can, but also I think many of you who are working in different settings understand how challenging it is at time. And those who are working are going to be unfortunately affected in ways that they've not been before. But we know that that's important. We'll do what we can, but we also recognize that it is challenging. And so wanted you to be aware of that we are aware of it, and we'll do what we can. The other thing I wanted to talk to you all about while I'm getting also more questions, we know that things around accommodations for students with disability is a big one. And again, I'd like Dean Clark to speak a bit to that in particular, because we know that that is certainly something on the mind of some of our families, and understandably and rightfully so. Thank you.
A couple thoughts there. One, all existing accommodations remain in place, and our faculty have been instructed to honor all existing accommodations. Those accommodations will continue to be supported by our Academic Support and Access Center, which Fanta referenced earlier, that will continue to provide its services and will do so through the virtual space. One thing I would like to note is that for some students, the online learning modality may present new challenges for them that need to be accommodated. I would ask them to reach out to the Academic Support and Access Center as appropriate to seek accommodations, certainly to speak with their faculty members and or academic advisors about support. And again, I have encouraged faculty to move forward with understanding, flexibility, and human compassion as we move into this new online space. So accommodations already existing remain in place. Any new accommodations that may be needed, please reach out to the various bodies that I referenced. Thank you.
I also want to turn a little bit to what is on the ground here at American University. As many of you are families with, with your students, I also know that for many, you also within your workplaces are seeing quite a bit of changes with people being, there's been strong recommendation to go telework, social distancing and all of that. American University is no different. We have also been thinking about our workforce and what we need to do with our workforce to make sure that we are looking at the safety and well-being of all, our students first, our faculty and our staff equally. And so we have moved into a telework mode. And yet we also know that there's some folks for whom they have to physically be on campus. And those folks would be on campus during that period of time, and we have identified who those are. As you can imagine, folks have been going 100 miles an hour with many, long days and so forth. We also are planning for contingency. And it's the questions of what happens when, if and when members of our workforce, for different reasons, are not going to be able to continue their functions. So we have been working on what our contingency plans are. And I'm sure as families, one of the questions that is being asked is, what is the plan if faculty members get sick? And then,
so I've been discussing that with the provost and with our dean colleagues. And what we have been encouraging our deans to do is to identify faculty who can serve as backups for any colleagues who become ill. There are faculty who have volunteered to guest lecture or to take over courses as needed. And certainly we can identify new faculty if necessary, appoint new faculty to take on coursework as needed for academic continuity purposes. So please know that's very much on our radar, and we're taking appropriate steps to address it. Thank you.
And likewise, we're doing the same thing for staff as well, is working on contingency plan to understand, if members of our team have to step away, who takes over and how would that happen. We're definitely looking at that at all part of our organization, including at the leadership level. Those are things we all have to plan for, and those are things that we are doing accordingly as well. But we just wanted you to know that. There's a question that came up, and I want to pose it to Tracy Calandrillo. It says, will advisor do wellness check for students' mental health during this period of time? And then also I'd like Dean Clark to chime in on some of the advisors' work as well.
So I think a general thing I would say is that advisors are doing their best to communicate with students about just generally their adjustment to the online process. With regards to the word wellness check is a specific thing that can mean different things to different people. Our advisors are going to be doing their best to connect to students, but what we're not going to be able to do is contact every single person to say, how are you doing in terms of their mental health or their well-being. So what I would really recommend that everyone consider is to utilize the resources that we have available. And for family members, you can also contact us to talk about what should I do next, or what are the connections that you'd recommend for my students. We have a lot of information that's just general for everyone about how to take care of yourself during this time. I think that that's something that I know I can relate to. I have children of my own. We are all spending time in our house talking about how we take care of ourselves. I'm encouraging my staff to do the same. And so, certainly your students are not immune from the incredible stress of trying to make an adjustment like this in the middle of a semester, and to move their living situation while at the same time still being expected to learn. And so it's very natural and understandable that people are going to have impacts of that stress. And so what I'd want everyone to do is to consider leveraging the resources that are available that just talk and offer some really concrete things that everyone can do to manage that stress. But with regard to doing a wellness check for students and for every student, we aren't going to be able to do that, and we are going to rely on our community to let us know when we are concerned about someone and they need us to outreach to them in a different sort of way, or make sure that they're connected to the right resources. That being said, people who are already connected to our counseling center and our health center are going to be contacted. If they already have a relationship with a therapist, they're getting contacted by that therapist to work through what to do to make sure that they have a treatment plan.
So this question also had come up. What if a student gets sick, course accommodation? Can we talk about that? Because there's a process and it's through the Dean of Students Office, etc. So please, Tracy, talk about this.
That's a really great question. And that happens all the time anyway. People get sick, they have accidents, they have something going on at home, and they use the Dean of Students Office as a connecting point to make sure that they have what they need to communicate with faculty about that, and to just help them problem solve through that process. And so that will continue for sure. Faculty and members of our community here on campus have access to what we call the Care Network. And so if a faculty is concerned about a student, they will continue to go through a process of submitting a care report to let our Dean of Students and the rest of the student support team know that they have a concern. But what I would recommend to families and to students is that if a student gets sick or they have a situation, they need to reach out to our Dean of Students office and make an appointment. Most of the time, those are relatively quick appointments where we're just talking through whatever it is that's going on and making sure that students are connecting to the ways to communicate with their faculty about that. Sometimes those situations are more complex and require a little bit more of an interaction with us to figure out what the next steps are going to be. But absolutely, that support is very important for us to provide for the community. And there's information about that on the FAQ page, and of course, information on the Dean of Students page as well.
Again, for our families, we've come to our time, to the end of our time. And I wanted to say a couple of things. Once again, thank you. Thank you for making the time to join us. Thank you for sending us your questions and your comments. Thank you for the work that you all are doing with us on this. These are difficult times. I've been saying to my team here and at the university, there is no playbook for this. There truly is no playbook. What I can say to you and what I can assure you is we have been preparing for this. We continue to prepare for it, and we will respond accordingly. Understanding that we're going to have to be flexible, we're going to have to be creative, and we're going to have to problem solve very quickly. We understand that, and we are very much aware of that. As I've always said to our families, this is a partnership, and it's a partnership that is based on trust. It is a partnership that is based on us learning together and problem solving together. We are committed to making sure that these young people who come to us leave our institutions not only educated and have the education that they need, but that also during the period that they have here, that we continue to learn about our own common humanity. That's really important to all of us and for what we do. That is a daily commitment on our part, and we will not always get it right, but we will do our best, and we will continue to commit to doing our best. We know that for the students who are leaving, in some ways, I want you all as families to understand that in some ways they're grieving because they may not have had the exact closure that they were seeking and all of that. This was not anyone's plan. It really wasn't. But this is what we're confronted with, and we will do everything we can together. For the families, on a lighter note, as I was talking to a parent over the weekend who was picking up her student, she said, you know, she had gone ahead and she had already gone ahead and taken out sort of the paints in the room and all of that, because from her perspective, you know, her daughter was now in college. She had taken the time to make sure her room had stayed the way it was, and she had pretty much taken care of that, and now things have changed. I say this on a lighter note to say that part of our coping mechanism for all of us during this period of time is to figure out where can we find that guiding light and where can we find that shining light in what is absolutely unprecedented. I believe that together we'll be able to do that, and I continue to we'll continue to take in your questions and your suggestions, and we'll continue to work with you. And on behalf of all of my colleagues here at American University, we wish you well. We wish you to be safe. We wish everyone health as much as we can. And thank you for your time. And to my colleagues who are on this call, and to the thousands of colleagues who are here at American University who have been on this, I too am so proud to be a member of American University on this day and what we are all facing. Thanks again to our families. We wish you all the best. Thank you.
Thank you.